Good day, everyone. You're welcome to my YouTube channel, Everything Medical. On today's video, I'm going to be treating the anatomy of the wrist joint, the radio-carpal joint. Wrist joint is a vital joint in the upper limb. Before I dive into this class, I'm going to be doing a little bit background study on how the upper limb is being fashioned. First of all, this is my shoulder region. This is my arm, which can be called the brachium. This is my forearm, which can be called the antebrachium. Now, this is my hand, which can be called the manus. That is how the upper limb is being partitioned according to their regions. Get. Now, this is my hand, Get. Now, here is the wrist joint. That means the hand is distal to the wrist joint. Something distal is something that is away, while proximal is something that is closer. So the hand is distal to the what? To the wrist joint. You get. And in the wrist joint, it's not just formed by the distal end of the ulnar and the radius and the proximal row of the carpal bones. It's not that way. We have what we call the wrist joint complex, which is being formed by the inferior radio-ulnar joint, the wrist joint itself, and the mid-carpal joint. You get. Now, let's then dive into the introduction of this topic. Because that I said previously that wrist joint can be called the radio-carpal joint. That means it's between the radius, particularly, and the carpal bones. But in carpal bones, it is the proximal row of the carpal bone. Because the carpal bones or the carpus are being arranged in two rows, the proximal row and the distal row. All of them are arranged from lateral to medial aspect. So that is all about how it is being fashioned. Now let's dive into the introduction of this topic. The introduction. Okay, what is wrist joint? Wrist joint is a synovial joint of ellipsoid variety that is formed between the lower end of the radius and the carpal bones or the carpus. That is the concept of the wrist joint. You get. So, that is how it works. So that is the introduction of the what? The wrist joint. Is between the distal end of the radius and the proximal row of the carpal bones. Okay, so the wrist joint, which can be called the radio-carpal joint, is a synovial joint of ellipsoid variety between the lower end or the distal end of the radius and the carpus or the carpal bone, particularly the proximal end or the proximal rows of the carpal bone. So it is an ellipsoid variety. Ellipsoid variety, you get. So now, this is the radius. This is the ulnar bone. You get. Now, this row is the proximal row of the carpal bone. The proximal row of the carpal bones, while this row is the distal row. So that means from the distal end of the radius to the proximal row of the carpal bones is the wrist joint. So this dotted red line indicates the wrist joint. So this is the wrist joint. That is the wrist joint. While between the proximal row and the distal row of the carpal bones is the mid-carpal joint. This dotted line indicates the mid-carpal joint. the mid-carpal joint. Okay, recall that we have a joint that exists in the wrist region, which is known as the inferior radio-ulnar joint. The joint that formed by articulations between the distal end of the ulnar and radius. So there's a joint that exists here between the both distal end of the radius and the ulnar. It is called the inferior radio-ulnar joint. So here exists the inferior radio-ulnar joint. So there are three joints that forms the wrist joint complex, or the wrist complex, which is the inferior radio-ulnar joint, the wrist joint, and the mid-carpal joint. Okay, so that is how it works. Okay, the next we'll be discussing is the type of the joint. Type. It is a synovial joint of ellipsoid variety. That is all about the type of the wrist joint. It belongs in a synovial joint family. You get our classification. So it is an ellipsoid variety of a synovial joint. Okay. Now, let's delve into the next outline, which is the articular surfaces. Articular surfaces. It is a joint, so it must have an articular surface. The articular surface of the wrist joint is divided into two: the proximal articular surface and the distal articular surface. Proximal articular surface and distal articular surface. Articular surface. So the proximal articular surface of the wrist joint is formed by the inferior surface of the lower end of the radius. It's formed by the inferior surface of the lower end of the radius and the inferior surface of the triangular articular disc of the inferior radio-ulnar joint. Now watch this diagram now. This is the proximal region of the wrist joint, while here is the distal region of the wrist joint. You get? So the proximal articular surface is formed by the inferior surface of the lower end of the radius. Look at the lower end of the radius, this region. It's formed by the inferior surface of the lower end of the radius and the inferior surface of the triangular articular disc of the inferior radio-ulnar joint. This is the triangular articular disc. This is the articular disc of the inferior radio-ulnar joint. It is elliptical in shape. You get? Generally, the articulation of the wrist joint is elliptical in surface. The articular surface of the wrist joint is elliptical. That is why it does not permit rotational movement. The wrist joint does not permit what? Rotational movement. It only permits other range of movement except what? That rotational movement, because the articular surface is elliptical in shape, but it is being compensated by the supination and pronation of the forearm. You get? That is what that compensates it in respect to the reason that it lacks a rotational movement. So the proximal articular surface is formed by the inferior surface of the lower end of the radius and the inferior surface of the triangular articular disc of the inferior radio-ulnar joint. That is how it works. That's how it works. So this region is the proximal articular surface. Why this region? This proximal rows of the carpal bone here is what we call the distal articular surface. You get? Now, recall that the articular surface of the wrist joint is elliptical in shape. It has an elliptical surface. I've said it previously that it is the reason why it does not permit a rotational movement. You get this articular disc is what is concave, meaning that it is what it is shallow or hollowed. A concave surface is a surface that is hollow or shallowed, or it can be called a female surface. So this is the articular disc. Articular disc of inferior radio-ulnar joint. You get it? Important to note, the ulnar bone or the distal end of the ulna does not associate or contribute to the articulation of the wrist joint because it is being excluded by the triangular articular disc of the inferior radio-ulnar joint. You can watch it here. The distal end of the ulna does not make a true articulation. It does not contribute in articulation of the wrist joint because it is being excluded or covered by the triangular articular disc of the inferior radio-ulnar joint. It is only the distal end of the radius that made a true articulation, or it involved in the articulation of the wrist joint. That is why the wrist joint is a synovial joint of ellipsoid variety that is formed between the lower or the distal end of the what radius and the carpal bones, particularly the proximal roll of the carpal bones. Get so that is how it does what it works. Okay, now the distal articular surface of the wrist joint is formed by the proximal roll of the carpal bones. The proximal roll of the carpal bones. And the proximal roll of this carpal bones is smooth and convex. That means it is smooth. And why is it convex? Because it is what? Arched. It has an arched surface, or it has a rounded surface. You get? So the first carpal bone on the proximal roll is the scaphoid. We have the scaphoid. The scaphoid. We have the lunates. We have the triquetra. You have the triquetra. So the scaphoid, the lunate, and the triquetra, and the pisiform forms the proximal roll of the wrist joint. You get, and that is what that forms the distal articular surface of the wrist joint. So the distal articular surface of the wrist joint is formed by the proximal roll of the what? Of the carpal bones, which is smooth and convex. You get. Important to note, among these four proximal roll of the carpal bones, the pisiform does not participate in forming the wrist joint. What does it do? It only acts primarily as a sesamoid bone, thereby relatively increasing the leverage of the extensor carpi ulnaris. And it is located in a plane anterior to the carpal bones. You can see it here. It does not participate in formation of the wrist joint, particularly the distal articular surface of the what? Of the wrist joint. It only acts as a sesamoid bone that increases the leverage of the extensor carpi ulnaris. And it is found in a plane anterior to the carpal bones. You get. So the pisiform does not participate in forming the wrist joint. That is the bones in the proximal roll of the carpal bones. You get. It's only the scaphoid, the lunate, and the triquetra that participate in forming the wrist joint. You get. While the proximal roll and the distal roll of the carpal bones forms the mid-carpal joint. It's only the proximal roll and the lower end of the radius that forms the wrist joint. Okay, that was a clarification. Okay, we are done from the articular surfaces. The next we'll be looking on is the ligaments. The ligament, very, very important. The ligaments. The ligament. The wrist joint has the following ligaments. We have number one, the capsular ligament. Number two, the radial collateral ligament. Number three, the ulnar collateral ligament. Number four, the palmar ligament. The palmar ligament, but it is called the palmar radio-carpal ligament. Number five, the palmar carpal ligament. And lastly, we call it the palmar radio-carpal ligament. Or it is known as the dorsal radio-carpal ligament. The dorsal radio-carpal ligament. So these are the ligaments of the wrist joint. These are the ligaments of the wrist joint. We have the capsular ligament, the radial collateral ligament, the ulnar collateral ligament, the palmar radio-carpal ligament, the palmar ulnar-carpal ligament, and the dorsal radio-carpal ligament. Yeah, that is how it works. Let's start with the capsular ligament. Once you hear capsular, it is something that encloses a particular structure. So the capsular ligament is a fibrous sac that encloses the joint cavity. So it's a fibrous sac that encloses the wrist joint. You get? So what does it do? It is attached above. It is what? Attached above to the lower end of the radius. It is attached what? Above to the lower end of the what? Of the radius. And below to the proximal row of the carpal bones. As you can see it here, these are the proximal row of the carpal bone, where you have the scaphoid, the lunate, the triquetral, and the pisiform. I said previously that the pisiform does not participate in forming the wrist joint because it serves as a sesamoid bone which increases the leverage of the extensor carpi ulnaris and found in the plane anterior to the carpal bones. You get? So the capsular ligament is a fibrous sac or the strong fibrous sac which encloses the wrist joint. It is attached above to the lower end of the radius and below to the proximal row of the carpal bones. Okay. The radial collateral ligament. The radial collateral ligament is another important ligament. This is one of the strongest ligaments of the wrist joint. What does it do? It extends from the styloid process of the radius. It extends from the styloid process of the radius. It extends from where? The styloid process of the radius and to the lateral aspects of the scaphoid bone and the trapezium. The scaphoid bone and the trapezium. So it extends from the styloid process of the radius to the lateral aspect of the scaphoid bone and the trapezium. So this is the radial collateral ligament. The radial collateral ligament. It extends from the styloid process of the radius to the lateral aspect of the scaphoid and the trapezium. So here is the trapezium bone. This is the trapezium. The trapezium bone. This is the trapezium. Okay, right here is the trapezoid. Okay. There are those bones that form the distal roll of the carpal bones. So here is the trapezoid. Here is the capitate. Here is the hamate bone. Okay. This is our fifth metacarpal. This is our first metacarpal. This is fifth, not first. Okay, this joint is called the first carpometacarpal joint. The first carpometacarpal joint. First carpometacarpal joint. First carpometacarpal joint. So that is all about the radial collateral ligament. It extends from the styloid process of the radius to the lateral aspect of the scaphoid and the trapezium. Okay. The ulnar collateral ligament. This is the ulnar collateral ligament. The ulnar collateral ligament. What does it do? It extends from the styloid process of the ulnar bone to the medial aspect of the triquetra and the pisiform bone. As you can see it here, it extends from the styloid process of the ulnar to the medial aspect of the pisiform bone and the triquetra bone. So that is how it works. Recall that the radial collateral ligament is related to the radial artery. Very, very important. Okay. So we have discussed the ulnar collateral ligament. Let's dive into the palmar radio-carpal ligament. The palmar radio-carpal ligament. So this is the ligament here. Radio-carpal ligament. The palmar radio-carpal ligament. The palmar radio-carpal ligament. This is an important ligament in the wrist joint. You get? How does it work? It extends from the anterior surface of the lower end of the radius. It extends from the anterior surface of the lower end of the radius. To tell you how it works, it extends from where? The anterior surface of the lower end of the radius, or the anterior margin per se. So it extends from the anterior margin of the lower end of the radius to the anterior surface of the proximal roll of the carpal bones. As you can see it here, these are the proximal roll of the carpal bones. So the palmar radio-carpal ligament extends from the anterior margin of the lower end of the radius to the proximal roll of the carpal bones. That is how it works. Okay. The palmar radio-carpal ligament. Look at it here. The palmar radio-carpal ligament. It is known as the palmar carpal ligament, not radio-carpal. Palmar This is the palmar carpal ligament. It extends vertically downward to the base of the stellate process of the ulnar bone and to the adjoining part of the anterior surface of the articular disc. You get? So it is a vital ligament in the wrist joint which extends vertically downward to the base of the stellate process of the ulnar and to the adjoining part of the articular disc to the anterior surface of the triquetral and the lunate bone. So the ligament attaches downward to the lunate and the triquetral. So each fibers causes this region as well. You get? So it attaches on the anterior surface of the triquetral and the lunate carpal bone. So the dorsal radio-carpal ligament is not seen anteriorly, it is seen on the dorsal aspect of the wrist region. Get the dorsum of the wrist. So the dorsal radio-carpal ligament is a vital ligament. Get so it extends downward medially to the posterior margin. It extends downward medially to the what? To the posterior margin of the lower end of the radius and to the dorsal surface of the carpal bones, particularly the proximal roll of the carpal bones, which includes the scaphoid bone, the lunate, and the triquetral. You get? So the dorsal radio-carpal ligament extends downward medially to the posterior margin of the lower end of the radius and to the dorsal surface of the scaphoid, lunate, and the triquetral bone. So that is how the ligament causes or runs on the dorsal aspect of the wrist region. So the next we'll be discussing is the relation. The relation. Okay. Relation. We have the anterior relation, the posterior relation, the lateral relation, and medial relation. Okay, on the anterior relation, it is related to the flexor digitorum superficialis, flexor digitorum profundus, mainly on the tendons and the associated synovial sheath of the wrist joint, where we have our ulnar bursa. You get? Now, it is also related anteriorly to the flexor pollicis longus. It is also related to the what? To the flexor pollicis longus and its associated synovial sheath, where we have the bursa as well. And it's also related to the median nerve and the ulnar nerves and vessel. You get? So that is all about the anterior relation. On the posterior relation, it is related to the extensor tendons of the wrist and fingers and its associated synovial sheath. Okay. On the lateral relation, it is related to a vital structure. On the lateral relation, it is related to what? A vital structure, which includes laterally to the radial artery, which is related to the radial collateral ligament. Number 2 relation of the lateral relation, we have the tendon of abductor pollicis brevis and the tendon of extensor pollicis longus. So those are the relation on the lateral aspect. On the medial aspect, it is related to the what? To the dorsal cutaneous branch of the ulnar nerve. The dorsal cutaneous branch of the ulnar nerve. So that is all about the relation of the what? Of the wrist joint. Okay. We delve into the next one, which is the blood supply. The blood supply. On the blood supply, it is being supplied by the radial arteries and the ulnar arteries. Okay, the radial artery and the ulnar artery. Now, on the nerve supply, it's being supplied by the radial nerve, the median nerve, and the ulnar nerve, particularly their branches. You get. So it's being supplied by the radial nerve, the median nerve, and the what? And the ulnar nerve. So those are the nerve supply or the nerve innervation of the what? The wrist joint. Now we'll go to the movement. The movement. On the movement, we have flexion and extension. We have adduction and abduction, and we have circumduction movement. Okay, flexion and extension is on transverse axis, while adduction and abduction is on anteroposterior axis. The circumduction movement is a 360 movement, but there's how it performs on the wrist joint. You get. Recall that the wrist joint, you get, the movement on the wrist joint is not only associated with the wrist joint only. It is associated with the mid-carpal joint, which is the joint between the proximal roll of the carpal bone and the distal roll of the carpal bone. So that is why the wrist joint together with the mid-carpal joint is called the link joint. It's known as the what? The link joint. Recall that in a neutral position, you get, it is only the scaphoid and the lunate bone attaches on the radius and articular disc, while the triquetra only attaches on the articular disc, particularly in when the wrist is fully adducted. It is a full adduction of the wrist that the triquetra attaches on the articular disc of the wrist joint. While for scaphoid and lunate, it is only on a neutral position, in which it attaches on the radius and the what? Articular disc. Okay, now let's dive into the clinical relevance. Clinical relevance. On clinical relevance, number 1 is the ganglion size. Ganglion size is a non-tender cystic swelling that occurs mostly on the dorsal aspect of the wrist region. It is caused as a result of the mucoid degeneration of the synovial sheath on the wrist joint. That is what that causes what? Ganglion size. So it is a what? A non-tender cystic swelling that occurs mostly or being common on the dorsum or dorsal aspect of the wrist, which is being implicated or caused by the mucoid degeneration of the synovial sheath of the wrist joint. Okay, it appears harmful. You get. Now, number 2 is aspiration on the wrist joint. Aspiration on wrist joint. Wrist joint aspiration is done by inserting the needle on the posterior aspect of the wrist region. You get, below the styloid process of the radius. That is between the extensor pollicis longus and the extensor indicis. You get. So that is where the needle is being inserted to aspirate it for a clinical diagnosis. You get, or a biopsy. So that is how it works. The number 3 is immobilization of wrist joint. Immobilization of wrist joint. This wrist joint is immobilized on the position 30 degrees of dorsiflexion. That is how immobilization of the wrist joint is conducted, on the position which is 30 degrees on dorsiflexion. Okay. The number 4 is fracture. Fracture of scaphoid bone. Scaphoid bone is the most common carpal bones to undergo fracture. It is commonly fractured as a result of fall on outstretched hand. That is force. Fall on outstretched hand. Fall on outstretched hand. So it is what that causes the fracture of scaphoid bone. And when scaphoid bone got fractured, it could cause avascular necrosis, whereby there will be retrograde blood supply to the wrist region, because the radial artery courses along where the scaphoid bone is located. That is on the floor of the anatomical snuff box. You get, on that region. Okay. That is how it works. Then number 5 is dislocation. Dislocation. Yes, it's a joint. It can easily get dislocated. You get, maybe as a result of fall on a stretched hand as well, which could lead to its dislocation. So we have stated the clinical relevance that is associated with the wrist joint. We have treated it from the introduction to the clinical relevance. I believe you enjoyed this class properly. In our next class, we'll be treating another vital topic in upper limb. Thank you so much for staying to the end.